Hello everyone, today's video is about flare-ups from various substances. Folks are asking about flare-ups related to vitamin C, flare-ups from glutathione, flare-ups from methylene blue. So I thought I would do a little flare-up video and just cover all these topics today. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if you wouldn't mind, please taking a quick moment to like, share, subscribe, and or post a quick comment on the video. I'd really appreciate it. So thanks in advance for taking a second to do that. So the first question is, what would be the reason why something like vitamin C could make a Lyme/co-infection patient feel worse? I mean, it depends on the context for the vitamin C. So if it was, say, high dose intravenous vitamin C, then it could be causing a flare-up because it is oxidative and antimicrobial and could be causing a die-off/Herxheimer reaction. So that would be the most likely culprit in that case. Usually just dialing the dose down till a tolerated dose is achieved and then titrating it up until, the max therapeutic dose could be worked with or the max tolerated dose could be worked with would be the way that I would work around that with one of my patients if that happened at my clinic. That being said, there's no specification that it was intravenous, so why might someone react to oral vitamin C if they had a diagnosis of Lyme and or co-infections? So that would be really quite surprising to see that. Now, that being said, it would depend kind of on what the type of flare-up is, and yeah, so what are the symptoms that got flared up, or are they new symptoms that came up, and what's the dose of the vitamin C, and a few different things that would kind of be outstanding questions there. So if the person asking the question wants to flesh that out in the comment section, I'm happy to post another video and talk about it there. Just in general though, where a person might flare up from vitamin C for a couple of reasons. If someone was really sensitive to mold, particularly if they were really allergic to mold, there is a small possibility that they might react to vitamin C because some of the enzymes that are used in the vitamin C synthesis process use enzymes that are derived from Aspergillus species mold. That is true of a few different substances out there, substances that are conjugated to or bound to citrate, so say like magnesium citrate, potassium citrate, zinc citrate, all the different citrates that are out there. A lot of citric acid, to my knowledge, is derived from Aspergillus species mold. Plant-based enzymes, i.e. like enzymes that are not, say, like pancreatin or prescriptive versions of pancreatin like creon or codazyme, are oftentimes derived from Aspergillus species mold. So I've had a couple of patients over the years, and like only a couple out of thousands, so I think this is quite rare, as best I can tell, but I've had a couple of patients over the years where they cannot tolerate anything, or they could not tolerate anything that was derived from Aspergillus species mold. There are certain vitamins that are sometimes derived from Aspergillus, like grown on mold cultures, so it's kind of like weird to think about because we talk so much about like avoiding mold, but it is used in the nutraceutical industry to some extent. So that would be one possible reason, but again, it would really depend on the type of flare-up symptoms someone was having. The other reason that someone could flare from vitamin C would be related to the just that increase of that antioxidant. And if they were really low in vitamin C in the first place and then started taking it as a supplement, then it might cause a detox reaction because their bodies are finally getting enough vitamin C, and there might be some consequences of that. In other words, the vitamin C could cause their cells to be working better, which is good, but then that might disproportionately upregulate cells that are in their detoxification pathways, like in their liver, or their detoxification systems rather, like in their liver, and then that could cause a detox reaction. It's like, as I've mentioned in a number of my other videos, when folks start working with comprehensive mitochondrial support, it's really good for the cells to be making more energy, but if those detox pathway related cells are making more energy, then that could cause a flare-up to occur before the patient starts feeling better. Or like some of my patients, they're like, I have more energy, but I'm also like having more muscle pain, or I'm feeling like my skin is is flared up, like I'm having more acne lesions, or my eczema got worse or something. It's like we're seeing that increased energy production, but also seeing the aftermath of pushing detox pathways too quickly. So that would be a possible role there. Can't really think of any other reason that vitamin C would cause a flare-up per se, but again, like there might be some niche things that would come up. Like for example, excessive vitamin C supplementation can cause kidney stones. So someone's like, oh, look, I had a flare up, but it's you're not having all this like flank pain, like, I'm passing kidney stones, like, well, that could be related, but I'm sure that's not the nature of that question. Anyways, I'll leave that one there. Any follow-up questions on that, just post in the comment section below. The next one is a little bit long, so I'm gonna titrate it down here. So I have slightly low thyroid levels, which I control by eating non-goitrogenic foods. Goitrogenic meaning able to cause a goiter, i.e. like thyroid enlargement. Those are usually foods low in antioxidants, which means avoiding dark foods with polyphenols like broccoli, red wine, strawberries, etc. It works like a charm. I got exhausted for 2 days after the last 2 times I took methylene blue. Could that be because it lowered my thyroid levels in the way goitrogenic foods do? Also, I'm going to do more research, but I'm wondering if methylene blue can be dehydrating in a similar way that creatine does. I don't drink a lot, so maybe it dehydrates me. And yeah, they're wondering if I have any thoughts on that. So thank you for the questions. Yeah, so I have not seen methylene blue have a negative impact on thyroid labs for any of my patients so far. Not saying it couldn't happen down the road, but I'm not aware of methylene blue having any goitrogenic effects whatsoever. So I don't know of that being a thing. I have not heard of that being a thing. And there are some methylene blue experts out there that lecture at the at conferences and put on courses about this type of thing, and I've not heard anybody say that. So not to my knowledge, and I have not seen it in my own clinical practice. So someone feeling tired after taking methylene blue could be due to other factors, a lot of overlap with what I said about vitamin C just a minute ago, whereas we start to get the cells working better, or in the case of methylene blue, it does help to actively start to detoxify the mitochondria. It could be a detox related thing. That would be a more likely explanation in my mind than it being goitrogenic, but anything's possible. But I don't think that one's possible. Then the other question was, can methylene blue be dehydrating in a similar way that creatine can be dehydrating? So in my experience, I've really not found creatine to be dehydrating. I know people talk about that, and when one is acclimatizing to creatine, there can sometimes be what appear to be dehydration-related effects. My understanding is that the creatine, especially if it's creatine monohydrate, it's bound to a water molecule. I believe it can cause more intracellular water accumulation, so it could potentially lead to some transient dehydration symptoms, but I've really not seen that in any of my patients, and I think it would be a short-lived thing. So just to say, I don't want to give creatine a bad rap and say, oh yeah, it's dehydrating, and I just don't know that that's really the case. But that's just been my experience with it. I'm not aware of methylene blue being dehydrating either. I have not heard any reports of that from anyone I've learned from, nor have I seen that in my clinical practice. So I don't think methylene blue is goitrogenic, and I don't think that methylene blue is dehydrating. But if anybody has information to the contrary, please post in the comment section below. I'm always happy to learn new things that I don't already know, hence new things. The final question here is, why could glutathione make a patient feel worse? So not to be too repetitive here, but everything I said about the vitamin C and the methylene blue, which very much overlaps in terms of why a individual could feel worse from taking those things, would apply to glutathione as well, being an antioxidant and having that in common with both methylene blue and vitamin C. Glutathione, though, I believe, if memory serves, posted a whole video about this before, about patient flaring for methylene blue. So keyword search my YouTube channel, easiest way to find that video if you want to cross-reference it. But the gist of that video is that glutathione is also involved in detoxification pathways in the liver, and so getting more glutathione in the mix could upregulate the detox pathways too fast and cause a person to feel unwell from excessive detox, or detox is happening too quickly. There could also be an imbalance between the phase 1 and phase 2 detox pathways, and again, that's another facet of the same answer, but it could potentially be if someone did feel worse from glutathione, it might be a clue that their phase 2 is too fast relative to their phase 1, or maybe that their phase 1 is too slow. So that could warrant some additional exploration, or maybe some kind of giving some attention to a known or suspected slower phase 1 detox pathway. Another reason that glutathione could cause a flare is that glutathione does seem to have quite a strong affinity for the brain, and it could specifically be causing more brain detoxification, or maybe start kicking some infections to the curb, because the glutathione is helping to improve the integrity of the immune system in the brain, and then maybe flushing out mold mycotoxins, flushing out chronic viruses, like chronic viral infections, flushing out Lyme, etc. Not to say that I would think about glutathione as being a primary tool to get things flushed out necessarily, but in some cases that might be part of what's happening. So I have had some patients where they feel worse on glutathione and they wind up responding really well in general to working with systemic antimicrobial herbs, for example. And so I have to wonder, like, did you feel worse from the glutathione because it was kind of, poking the hornet's nest in terms of microbial overgrowth in the brain? So there might be that facet potentially with glutathione too. But generally, if the patient feels worse on glutathione, I'm thinking it's probably upregulating the detox pathways too quickly. I hope this was of interest. If there are any follow-up questions on these topics or anything else, just post it in the comment section below, and I will do my best to answer as soon as I can.